Good evening, everyone. At least good afternoon, everyone. How are you today? Hope you're doing well. I am Jennifer Tillman, and I am bringing you our seminar series. And this month, we're going to be talking about Medicare. And our guest speaker today is Valerie Nixon. I know we have a couple of other people that are joining, but I wanted to go in and get started. So again, I'm Jennifer Tillman. I'm a real estate agent with Keller Williams. And I also coach, life coach, transformational coach, grief coach. And I'm also part of the Prince George's Senior Provider Network, which is a great network of people who serve seniors and caregivers. And we continue to just bring lots of information to our caregivers and our seniors in the community. And I'm also, as I mentioned, a life coach, and I love working with individuals to help them be their best selves, live their best lives. And then I also have a Facebook group, Caring for the Caregivers of Prince George's County. So if any of you are interested in being on this Facebook group, this is where we post a lot of events that are happening, as well as the seminar series. It's a place where you can mastermind, you can ask questions of each other, but just let me know, and I will get you the information to join that Facebook group. And so this is how you would reach me. That's my website, but I will put this up again when we're done. So at this time, I want to introduce Valerie to you and get started with our seminar today. All righty, let's see. I just want to spotlight you, Valerie. And so I'm going to now share your screen.
Okay.
Okay, 1 second. Okay. All right, well, let's get started. Are you ready?
I'm ready.
And Valerie, please share a little bit about yourself.
Sure. Hello, everyone, and thanks for joining. I am Valerie Nixon. I am a local licensed healthcare agent. I also provide life insurance, dental, vision. I also talk to folks about other benefits, ancillary benefits, short-term care, which is something that Medicare does not cover. And a lot of people assume that it does. So that is something that is very important for all of us to consider as we age every single day. But today we're going to be talking about Medicare 101. Medicare does have the first 4 letters of the alphabet associated with it. And we're going to watch this short video to go over the first 4 letters, and then we'll dig in deeper about how each letter is actually used in your healthcare plan. Is it playing for you? There we go. And you can enlarge it. There you go. Yep. You may have to adjust your volume. Do you have your volume active? It should be playing in with audio.
Rehabilitation facilities, as well as skilled nursing facility.
Let me start it over, sorry.
That's okay, thank you.
New to Medicare? We know it might seem a little confusing. After all, up until now, you probably haven't given Medicare much thought. Fortunately, the right information and guidance can help clear things up a lot. Learning about Medicare's 4 basic parts is a great way to start. First, there's Medicare Part A, which is hospital insurance. It covers inpatient care at hospital and rehabilitation facilities, as well as skilled nursing facility, hospice, and home health care. Typically, you won't pay a premium for Medicare Part A. It's coverage most Americans have already earned. Next, there's Medicare Part B. This part of Medicare is medical insurance, and it covers things like doctor's services, hospital outpatient care, ambulance services, preventive services, and more. You do pay a monthly premium for Medicare Part B coverage. Usually it comes out of your Social Security check. Medicare Parts A and B are both provided by the federal government. Together, they're what's known as Original Medicare. But there are still two more very important Medicare parts to go. Let's skip ahead a letter to Medicare Part D, prescription drug coverage. Medicare Part D plans are offered by private insurance companies, and they only cover prescription drugs. You have the option to add a Part D plan to your original Medicare coverage, while typically paying a monthly plan premium to the insurance company. That leaves us with Medicare Part C, or as it's more commonly known, Medicare Advantage. Like Part D, Medicare Advantage plans are offered by private insurance companies. They combine your Part A hospital, Part B medical, and often Part D prescription drug coverage into one plan. Plus, they usually include extra benefits like health and wellness that aren't part of original Medicare. With Medicare Advantage, you continue to pay your Part B premium, and you may also pay a premium to the insurance company. There you have it, the 4 basic parts of Medicare. Now that you know what they are and what they cover, you can approach Medicare with more confidence and be ready to choose the coverage that's right for you.
Okay, so there are 4 parts to Medicare, A, B, C, and D. And as the video stated, A and B are part of Original Medicare. Original Medicare covers 80%. The individual covers the other 20%. That 20% deals with your co-payments, your co-insurance, your deductibles. It does not include prescription drug coverage. The only thing that video said that is slightly different is it said that Part D, which is prescription drug coverage, was optional. It is not optional. It is a requirement. If you don't add a prescription drug plan to your coverage, you can be penalized. And that penalty is a lifelong penalty unless you are income eligible for extra help or a state prescription drug assistance program or Medicaid. Those are the only things that could possibly wipe out that penalty. And that penalty is based on how long you were without prescription drug coverage. So a licensed agent such as myself, when we're doing a sit down with a prospect, we're going to ensure that prescription drug coverage is part of your plan. The Part C plan is also known as Medicare Advantage. It's just stated in the video that it gives you additional services like wellness, but those additional services usually include dental, vision, prescription drug coverage. It also may include transportation and over-the-counter allowance. So it's a variety of different options that the plan may offer you, but it will include prescription drug coverage unless the individual is a veteran. And that's a different ball of wax we won't necessarily dig too deep into. The other option that individuals have when they enter into Medicare is a Medicare supplement plan. It is not one of the first 4 letters of Medicare. It is a separate plan offered by Medicare. Sometimes it's referred to as a Medigap plan. That plan does not include prescription drug coverage. It usually has a higher monthly premium. It does absorb a lot of the 20%, the co-pays that someone on a Medicare Advantage may have, but it doesn't include any additional ancillary benefits. So no dental, vision, you have to add those in. And you also have to add in the prescription drug plan. Typically, there are 9 Medicare supplement plans to choose from, and they have lettered, they're identified by letter. So A, Part N plan, G, F, and so forth. Are there any questions before I go forward?
I have one.
Okay.
What's the benefit over the supplement versus the advantage?
So some people think that the supplement plan gives them a little more flexibility in the sense that as long as the provider, the doctor, accepts Medicare, they can see any doctor that they want. There's no network. Medicare Advantage plans may have a network, but there are Medicare Advantage plans, and I don't want to assume that everyone is from Maryland, but there are Medicare Advantage plans available in Maryland that have PPOs. So a PPO also allows you to see providers in and out of the network. And just like with a Medicare supplement plan, it does require you to confirm with the doctor that they accept Medicare. If they accept Medicare, they will let you know. If they do not, you want to find another provider that does. And believe it or not, there are lots of doctors now that no longer accept Medicare. They offer what's called a concierge service. It charges you a higher annual rate to see that provider. They have a smaller group of patients that they see, but they do not accept Medicare typically. And when I say a higher cost, possibly $1,500, $2,000 a year just to be able to see that provider. And usually that provider is a primary care doctor, not necessarily a specialist. So you still have to absorb the cost of seeing a specialist if you have a concierge plan.
Do we have any other questions at the moment?
I have a question. What I know that when your birthday is coming up or something, you get an opportunity to change something. Can you speak to that?
Sure, that's called the birthday rule. It varies by state, but is everyone in the state of Maryland?
I am.
Okay.
Some might be in DC.
Okay, so the birthday rule for Maryland, I'm not sure about DC, but for Maryland, it is that you have 31 days after your birthday to change your Medicare supplement plan with a guaranteed issue. So let's just say you were on a plan F, and let's say you are now 75. Your premium is going to be relatively high, and you want to shop around. And you don't want to wait until you get a letter from your plan saying that it's increasing again, when you know you have this option of having flexibility with the birth rule. You can shop your Medicare supplement around to see if you can actually lower your rate. And that's something that a lot of people are choosing to do these days because Medicare supplement plans increase every single year, sometimes twice a year, depending on the carrier. But it gives you a guaranteed issue. Guaranteed issue means that you don't have to go through any health questions, so no underwriting.
Thank you.
You're welcome.
Okay, I don't think we have any other questions right now.
Okay, so original Medicare, let's just talk about that for a little bit.
We did it, Marty. Okay, someone said government employees have slightly different rules and requirements. Part D is not necessary.
So I cannot, and I did write a note for myself because I know oftentimes I run across federal employee folks. I am not authorized to speak about federal employee plans. They are totally separate from the commercial plans in the Medicare spectrum, or Medicare world. And it's always best to go to OPM to learn more about your federal employee plans. And when I'm often set up in like a CVS or Walgreens, Giant, people will come across me in one of those environments, pharmacies, and they will stop and ask me questions. And one of the questions I do ask, are you retired from the federal government, county, or state? If so, you're not I don't want you to vacate those benefits. You worked hard for them. While these plans may be appealing and attractive to you, I always advise them, walk away, because your plan is not a revolving door. You can't walk away from your federal plan and then a year later decide, oh, I want to go back to it. It doesn't. You can do that with a Medicare Advantage plan. If you were on a Medicare supplement plan and you decided you wanted to try Medicare Advantage plan, you do have a 12-month trial period. If you decide you don't like the Medicare Advantage plan, you can go back to your Medicare supplement plan without any underwriting. And again, those are health questions. And it gives you that flexibility to try a new plan out for a year to see if it fits you. But federal government, you guys are a different ball of wax. So you have to go to OPM.
Okay. No other questions right now.
Okay, so I just want to touch on Original Medicare for a minute. So Original Medicare, what it does is it covers 80% of your coverage. The other 20% is the member's responsibility. Original Medicare is just the first two letters of the alphabet, A and B. And one night in the hospital with Original Medicare could be over $1,600 for a 1 to 60 day stay. And then it increases incrementally each day thereafter. So days 61 through 90 is $400 a day. Day 91, it goes up to $800 a day. So Original Medicare is not necessarily an option for many people that are concerned about bills and managing their care. Original Medicare does not include prescription drug coverage, as we discovered. It does not have a maximum out-of-pocket limit, so it doesn't necessarily protect you financially. For example, let's say a person went into the hospital for 10 days, and within 60 days, they return to the hospital. They have to pay the deductible again. It's not as if it separates and says, oh, you're still within your 60-day window. A Medicare Advantage plan puts a ceiling over your head. It's often referred to as the maximum out-of-pocket limit. So that limit is a set amount that is agreed upon from the Centers for Medicare and Medicaid Services, CMS. Each plan that's available in Prince George's County has a maximum out-of-pocket limit. So, for example, there may be a plan in Prince George's County or state of Maryland, various counties, that has a maximum out-of-pocket limit of $7,550. How does somebody arrive at that number? So you take your deductible, your copay, and your coinsurance, and you subtract it from that amount. The biggest copays for most of these plans are your hospital stay. When you have a hospital stay, some of the plans may have a daily copay that you pay for, say, the first 5 or 6 days of the hospital stay. And then some plans may offer on day 7 and beyond unlimited hospital coverage at a $0 copay to the member. So the two largest expenses usually with a Medicare Advantage plan is your hospital stay. It could also be skilled nursing. Medicare covers the first 20 days of skilled nursing, and then the next 21 through 100 for some or most Medicare Advantage plans, it's $203 a day. With Original Medicare, it's $204 per day. So when we look at Medicare Advantage plans, while they may have additional benefits, we want to also protect you from having out-of-pocket expenses that you may not be prepared for. The way to do that is making sure that individuals understand. You always have options such as creating a payment plan to cover the expense, and also considering a hospital indemnity plan. Hospital indemnity plan might be a small copay that you add on to your Medicare Advantage plan to cover your hospital costs as well as skilled nursing. And when I say a small premium, it could be a premium that's less than $45 a month. And it's really designed to just cover your hospital costs as well as skilled nursing and maybe ambulance costs. Those are all things that I go into detail about with anyone that I'm sitting with and going over a plan. There are plans in Maryland that have a $0 monthly premium that are Medicare Advantage. They include $1,250 for dental. In one case, one of the other carriers offers $3,000 a month for dental. They include vision and allowance that of $250 maybe that will provide you with, it offsets rather the cost of glasses for you. Transportation is another thing that the plan may offer. So Medicare Advantage plans, they offer you a lot of variety in one plan, and many people, 50%, 52% rather, of people choose Medicare Advantage plans these days because it does bundle everything into one plan. Are there any questions about any of the things that I just mentioned?
I have a question.
Okay,
I just have Medicare regular plan,
original Medicare.
original, original. So the original Medicare plan, if it doesn't cover all of my hospitalization, wouldn't my supplemental pick that up?
Okay, so you said two things here. You said I have just Medicare, but then you said supplement.
I have a supplemental also, I'm sorry.
Okay, that's okay. Most people, think that they only have original Medicare, but a supplement is helping to cover your copays. So when you say supplemental, you're either referring to maybe a plan G, F, or N.
Yes, I have F.
F as in February, okay. So
Yes.
that tells me a few things. It tells me, one, you had Medicare before the year 2000.
Yes,
Your F plan covers everything across the board. You literally walk into the doctor's office, you hand them your card and get services for whatever, whether it's a hospital stay, skilled nursing, if it's just a routine visit. You don't pay anything out of pocket because you pay your monthly premium, you pay your Part B premium, and your plan covers the rest of your services. That's the Cadillac plan, basically. But someone, for example, who has a plan G, they may have a one-time deductible that they meet every year, and then they walk in and out of the doctor's office, hospital, same thing. So your supplemental plan is your plan that pays for your A and B services.
okay, okay.
And then
So-
you also have a prescription drug plan, is that correct?
Yes, I do. It's separate.
Oh, yes,
And plus I have, what is it, prescription. I think I'm covered with everything. It's,
Yeah.
and my dental plan is not, is separate also.
correct. Because supplemental plans do not provide dental,
Dental, vision.
vision, hearing, or prescription drug coverage. So, and that's why a lot of people do choose Medicare Advantage, because it bundles everything into one plan, and as you get up in age with your plan F, you will see that your premium is going to increase year after year. If ever there comes a time where, you want to explore other options, you can definitely give me a call and we can look to see what else is available that could lower your costs. without increasing, well, could lower your costs. Not necessarily Medicare Advantage, but Plan G, for example, may lower your costs with only one copay. And that is your Part B as in boy deductible. And this year it's $240. So you pay $240 during the year, and then you pay your monthly premium as you've always been doing. And you walk in and out of the doctor's office just like you do with the Plan F.
Oh, okay, okay.
Okay.
And your phone number will be on the information here.
Well, thank you. And I was actually just going to provide that. It's 301 719 5761. So that is a recorded line. When you call that number, it's going to say to you, this call may be recorded for quality assurance or training purposes. When I actually come on the line, I will repeat that same disclaimer, but it will be a little longer. What I generally say, especially if it's our first time talking, I will say this call may be recorded for quality assurance or training purposes. We do not offer every plan available in your area. Currently, we represent 9 organizations that offer 50 products in your area. And please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program to get information on all plan options. So if you are getting calls from all of these different, numbers, and they don't read a disclaimer to you, that tells you, one, they are not I'm on the wrong side, not a licensed agent. I'm seeing my reflection here. I'm looking over here, but my badge is over here. So they are not a licensed agent. And so that should raise, the hair on your neck and make you say, okay, wait a second. This person didn't tell me they're on a recorded line. If during the call they transfer you to someone else, that's a sign as well. They should be able to take your call and, start speaking to you about what's important to you for your Medicare options.
And Valerie, I just want to repeat your number, 301-719-5761. Is that correct?
That is correct, yes.
Okay, I just want to put it in the I just put it in the chat so that everybody gets it.
Okay, thank you. And I'll try to also put my website in the chat. The website, and excuse me for a second, it does provide you with a variety of information, including Medicare 101, as well as you can provide or go out and look at quotes for yourself, the different coverage. It also has my license number on the website. And, that's another challenge question that you could always ask someone that's calling you. What is your NPN number? We're all licensed agents, all have an NPN number, national producer number, just like a doctor has a national provider ID number. So that's always a good way to check them right away if they can't provide that to you. And it's something that, we typically will remember first, or by the 4th time we're working with someone, you commit your NPN number to heart. So you can also register for the do not call. That doesn't always work that well, but you can go out to donotcall.gov to try to stop those robocalls, text messages, to protect yourself or your family members that are getting these phone calls and text messages on a daily basis.
Yeah.
And now we're moving into the annual enrollment season, which is October 15th through December 7th. The calls will probably come nonstop. It's unfortunate.
So true. And that's why I haven't changed. I'm afraid to change because of all of these different things that's coming up. I don't know what to select.
Well, that's why Valerie is here.
Okay.
And that's why, I'm often in different locations because, one thing is it's easy to work with a person that you've seen, that you've talked to on the phone versus a stranger who's calling or you're calling into a call center. So when you call the carrier directly and you just get anyone, they're there to just take your call and not necessarily know that when you say my doctor is located over in Bowie, they may pronounce it Bowie, and or they may not know where Adventist Hospital is, or Holy Cross, or Doctors Community. So they don't know the lay of the land. And also, they're not there to service your account afterwards. They're there to just get your enrollment and move on to the next person. The value that I bring to my clients is that I help service their accounts. So whether you have a question about how do I activate my card, or I received a bill and I don't understand why I'm responsible for this copay, or I need to find a doctor, or I lost my insurance card. Can you help me get another one? So Valerie does all of that for you. And that phone number that I did provide does not allow me to send text messages, but I can send an email. I have voicemail. You can leave me voicemail. I try to get back to all of my clients within 24 hours. I've been pretty successful over the years. I think I missed it once, and it was because I was on vacation and forgot to leave a vacation message. So I am here for my people, and it's a job I love.
Okay. Thank you so much for your info.
You're welcome. Are there any other questions? Has anyone ever had any issues with any of their plans that you weren't able to get resolved, or anything that you would like to share that's not too personal? Okay. So a lot of these plans also offer you, when I say these plans, I mean Medicare Advantage plans. They also offer you a 24-hour nurse hotline. The benefit of that is, let's say your doctor's office is closed for the day, or you have now a capsule instead of a tablet, and you're not sure how to take that medication, or you have just a question that you need medical advice on. You can call those hotlines 24 hours a day at no cost. And it helps you to make a decision about going to urgent care or emergency care. And a lot of programs now offer house calls. So this is when a licensed clinician will come to you to take your vitals, to learn more about you, to explain additional plan services that are available to you that you may not have known about. Diabetes is a big issue in our communities, and some of these some of these healthcare plans, when they provide these house call visits, they really hone in on what specifically is this individual having challenges managing. So chronic conditions like diabetes and COPD, they found that there are different things that they can offer the members to improve their care. And that's not something that you get with a lot of these Medicare supplement plans. It's not something that you're used to if you're under age 65 and you had the Affordable Care Act. So these are all things that are part of the Medicare Advantage plans, and they provide a lot of other rich services as well. Are there any other questions I could answer? I'm going to provide my email address. If you have any questions that you don't want to necessarily share in the group, you can always send me an email at phoenixin.insurance@gmail.com.
Say that again, I'm so sorry.
I said it kind of quickly, my apologies. V. Valerie. My last name is Nixon, Nixon. And then dot insurance spelled completely at gmail.com. I just came from the dentist too, so I may be a little slurred and, you know, I sometimes speak quickly, so you can always ask me to repeat something. And if you know any veterans, there are plans designed for veterans that provide them with a Part B reduction. I didn't speak about Part B for Medicare Advantage. This year, the Part B premium is $174.70. It is based on your income. If your Social Security income is $85,000 or less, then your Part B premium for the remainder of this year is $174.70. So Social Security automatically reduces your income by that Part B premium. You paid into Part A when you were working. If you look at your pay stub, it said Medicare. After 10 years and 40 quarters, you paid into the system. You no longer have to pay the Part A premium. But Part B, as soon as you retire, you start paying that premium. It will increase, maybe, or decrease for 2025. We don't have that information out at this time. So pay attention to that if you already have Medicare so that you can see what that new premium is. If your income is under $1,800 a month, you could qualify for medical assistance, also known as Medicaid. When you have Medicaid, it does pay for the Part B monthly premium, and it also makes you eligible for benefits and plans that have a $0 copay for many of the dental, vision, and hearing and transportation services. So different plans across the board for each individual based on their needs and what they qualify for. And I do help to determine if an individual is qualified for Medicaid or if they're qualified for any state program that could help reduce their out-of-pocket costs. So if you have anyone in your family that needs a plan review, the annual enrollment season again starts on October 15th. It runs through December 7th. If they would like to explore options, they can give me a call at no cost or obligation. I do plan reviews on October 1st through the 14th, but they can call now to just give me an idea of who their doctors are. If there are prescriptions that they take, I also look at those to see how plans cover those services for them. The number one thing that's important to most people is keeping their doctors. And that's something that I look into with the individuals first. I will always ask for your doctors, and I will always check prescriptions to make sure that they are married to the plans that are available in your area.
Mhm. We do have a question from Reverend Gentry.
Hello.
Hi, thank you. So you said that if your income is a certain amount or less, they review it, Social Security reviews it and lowers it. Do they do that automatically, or do you have to go in and ask them to review it if it's different than what it was a year or so ago?
So let me make sure I understand the question. Are you specifically talking about medical assistance, Medicaid?
Medicare, if you have Medicare and they take it out of your Social Security based on your income, right?
Correct.
Is that right? So say your income is lower than it was last year or the year before. Do
Okay,
you have to go into Social Security to have a review for them to lower the cost?
no, you don't have to go into Social Security. If they, and your Part B premium, the 174.70, which is what it is this year, let's just say your income dropped significantly. So let's say you were earning $2,000 a month after Social Security took out the Part B premium, and for whatever reason, it dropped down to $900 a month. Social Security would still continue to take out that Part B premium. But if your income, if you became eligible for medical assistance, they're not going to notify you. They're not going to say, oh, Reverend Gentry, you should, apply for medical assistance. That's where a licensed agent like me comes into play. You would call me and say, hey, I've had a change in my monthly income, significant change. Not likely to drop that low. That's probably a poor example, but do I qualify for any federal or state programs that could help me cover my medical costs? So I hope that addresses your question. When you do become eligible, for anyone who is eligible for medical assistance, you actually have to apply. You have to complete an application, which I could supply to you by email, or, if I need to drop it in postal mail, I send it to you along with my business card. And I can help you complete the application, but you have to apply. They don't automatically recognize that, Ms. Jones, who is 75 years old, whose income is below the poverty level, that she doesn't have Medicaid. You actually have to apply. And it takes about 30 to 45 days to process your application. There are times, unfortunately, when they lose your application and you have to start the process over again. But the nice thing about that is when you do apply, any Part B premium that they reduced or took from your Social Security, they will reimburse you. And
Thank you.
medical bills for 90 days. You're welcome. That was a long answer, but I hope I answered your question in that process.
I have a
Amina?
question.
Okay.
Did you say that we can call and get a plan review and that's at no cost?
Yes.
Okay, good.
As long as you're not federal government, county, or state. Yes.
Okay. Yeah, I'm thinking about my mom.
Okay, yes. And extra help is also known as low income subsidy. It's a program by Social Security. And so it's a federal program. 75% of Americans qualify, but they don't even know it. So that's another thing I review with you to see if you're eligible for that. What it does is it helps to manage the cost of your prescriptions. So your prescriptions could drop to zero for generic to $4.60. If it's a brand, the most you'll pay is $11.20. So we always want to look at federal and state programs to see if there's any qualifications there. And that's another thing that I do for individuals as well. It's part of the assessment process to help you determine, which plan might benefit your the things that you need to service your healthcare.
Mhm. Any other questions? I just keep posting your information just so that people have it. And
Thank you.
yeah,
I have a question. Are you part of Prince George's County
Network?
network?
Yes, I am. I recently joined.
Okay, okay.
Yeah,
Thank
I meant to say that in the beginning, that you're a new member of the Prince George's Senior Provider Network.
Okay, because that means that we don't have to pay a fee or anything um to change to talk to you.
Oh, you wouldn't have to pay a fee even if I weren't a member. I don't charge. I get paid by the carrier. So when an individual joins a healthcare plan, that plan pays me. So my services, whether I'm talking about Medicare, whether I'm talking short-term care services, there's never a cost associated with me coming out to speak to a group. I often do Medicare bingo classes. It's a fun way to learn more about Medicare. Much more interactive than, me being in front of a computer and talking about Medicare, because I get to engage more, which is my forte. I like to, walk around the room and talk to people and get them to be interactive at the same time. It helps to learn more about the program. I do a Medicare, so I do Medicare Bingo, Medicare 101. I've created a spelling bee program, which is nothing to do with Medicare, just something fun to do at a senior, building to get them
Okay.
engaged in different things. So I'm available for all types of activities.
Wonderful. Okay, thank you so much.
And there is a big change this year coming to Medicare, and it's the Inflation Reduction Act. So this is something that's beneficial to individuals that were paying for high prescription coverage for, like, say, Eliquis or Ozempic. It's reducing the cost, and it's reducing the maximum out-of-pocket limit from $8,000 to $2,000, which is extremely helpful to a lot of folks that were on those types of maintenance drugs. In addition, it may be an opportunity for other individuals to become eligible for the low income subsidy program. So that's also something to look into.
Are there any other questions? Mhm. So Valerie, you might want to give us some closing words, unless you had something else to share.
No, I will just like to say thank you so much for attending this Medicare 101 basic information. My website, again, does have a lot of very self-explanatory things, but most people prefer to talk to me about any questions that they have. So feel free to call the 301-719-5761 number, or email me. And I'm here to answer your questions and address your concerns. And if you need me to come out and speak to a group, I'm available to do that as well.
Yeah, and next time we may actually have you come out and so we can do the bingo and engage. Because that's what, we love engaging with people. And like, you said, it could be a fun thing as well. But I do thank you again, Valerie, for speaking to this group and providing this information. It's very good. And for the group, we will also be putting it on our YouTube page. And so look for that. We always send out an email afterward and let you know, that it will be posted, the time it'll be posted. So thank you guys for attending. Anyone has any other last minute question or anything you'd like to share, including you, Valerie?
I also will sometimes send emails, or the name of my company is Grace Benefits Group. I am part of a larger organization. Anytime that I'm unable to answer a question myself, I have a very long resource line, so no question ever goes unanswered.
Mm-hmm.
And thank you again very much.
Yes. Good to have you.
Thank
Thank you
you.
guys for attending. Look out for our next seminar next month. I don't remember what it is right now. Oh, it will be. It's not Dr. Ethel Mitchell. It's going to be on trust. She's going to go into more details on trust, making sure that you have the right information in your trust. Because sometimes people think that they have a trust on the house and everything's included, but it may not include that bank account or, so she's going to go into more details around wills and trusts. And that's going to be Attorney Ethel Mitchell. And that'll be next month on the second Thursday of the month at 2:00. So stay tuned in. And if you have any questions, feel free to call me or email me as well. But thank you for attending today and look forward to seeing you guys again. And we'll have Valerie back as well.
Thank you all and be well. Have a blessed week.
All
Thank
right.
you, and thank you all so much for the info.
Thank
Yeah.
you.
Great
Thank you.
presentation.
Thank you. All
Thank
right. Be well.